So my experience with migraine personally began in my 20s. I'd wake up with just a headache and feeling not at my best, and it wasn't because I'd been drinking the night before, and I'd just soldier on. I didn't think much of it until I woke at 3 a.m. one morning with this migraine visual aura, which looked like a giant paisley teardrop shaped thing. It was fantastically coloured. So then I realised I was having nocturnal migraines, and then having typical daytime episodes. Unfortunately, very triptan responsive. I can be at work, feel one coming on, chatting to a patient, and just excuse myself, pop next door, grab some MIGRAINE or whatever's in the sample cupboard, and within half an hour, I'm usually coming good. I find caffeine helpful. Some people, excessive caffeine causes headaches and migraines, but in a lot of migraine sufferers, the shot of espresso can actually help. I've been too lazy to take oral preventive medications, but I have dabbled with Botox for my migraines, just injecting the simple sort of frontal area, and that's definitely helped. And coincidentally, my migraines worsened when I started treating a lot of migraine patients. I don't know what that means. Maybe I was just overworked. That's the most likely cause, missing meals. But yes, in general, I've found the advice I give to patients is quite helpful for myself, lifestyle factors in particular. The actual treatment in good hands will take 5 minutes. I tell people there are a number of injections. They want to know how many. I just say there's a number of injections. There's actually around 40 injections, which sounds like a lot. But like I said, they're short, sharp jabs. Even people who are needle phobic, I've had to tolerate them. We don't numb the skin with anaesthetic or anaesthetic injections because that causes more pain and makes the procedure go for longer. So in all, they receive 40 injections spread out over the frontal regions, the temporal regions, over the base of the skull on the back and down to the shoulders here. There's no injections on the top of the head. And these are given initially every 3 monthly. Once people are responding, so I say commit to this for a year, get your life back, have some stability, and then in the second year there's the chance that you may not need it or that we can stretch it out to 3.5, 4 months, etc. I offer people trials of oral preventive medications at that stage because they essentially have episodic migraine and are still on Botox, but yes, we may be able to get you off Botox by adding in this oral medication. And about 5% of patients per year will drop off the Botox treatment program for one reason or another, success or using an oral preventive. There are a percentage of people, I can't tell you how many, that fail Botox after initial response, which is sad, but then we go on and look at other oral treatment options. So essentially I tell them you may need it for a year or two, you may need it for longer, but my hope is that you won't need this treatment for life. Coping with migraine is a big issue for many patients, particularly with chronic migraine. It's poorly understood. People will say it's just a headache. It's not. There's all these other symptoms that you know they experience. And it's been ranked as one of the most top 10 disabling conditions by the World Health Organization, etc. So these people are in trouble. There's often coincident mood disorders, depression or anxiety. They feel like they're failing their family or employers. So I do need to emphasize to people that, look, if you are depressed or anxious, you really need to address that because we know the interaction between chronic pain of any type, including headache and mood disorders. So people often need to go off and address their anxiety. I tell them I can't manage it myself. Options are to talk to your GP, as always, see a clinical psychologist or counsellor, or do nice things for yourself, even just have a massage or something like that. But yes, we know that there's a high percentage of comorbid mood disorders in chronic headache patients.